I caught up with Michelle Obama for an exclusive interview as she was heading outside to work in the White House garden that she planted earlier this year with local elementary school students.
As Barack says, we have some huge challenges in this country, and government can't do it all. And the same is true for health care. I mean, no matter what reform that's implemented, at some point, if we don't change the way we care for ourselves as individuals, if we don't eat better and if we don't exercise, and, you know, really what we need to do in this country isn't transformational, it's really walking 30 minutes a day, maybe 5 days a week, and starting with your kids on a different set of habits. Those things will eliminate obesity and cut down on costs. I mean, we're spending about $120 billion additional dollars a year in our healthcare system as a result of these sort of chronic illnesses that you see that are connected to obesity. We already know that.
I don't have to tell you, you know that others have lived at this address. They have tried to take on health care and reform, and they have not been able to be successful. So what's going to be different now, given that there's still the same challenges as before?
Well, I think what people are seeing is that the country has moved to another point in time. More and more people are ready for this kind of reform. There are going to be tough choices that have to be made, and no system is going to be perfect, which is why my side of the equation, the wellness side, is to me one of the true keys of changing the health paradigm in this country. If we are healthier people, then we won't need the healthcare system that we think will put us in a position that is unrealistic. You know, we're in charge of our own health ultimately.
A lot of people, they don't have the space, they don't have the access, they don't have, I mean, when you say organic, a lot of people go, I can't afford that.
That's right.
So how do you reach people in those communities?
Well, one of the things that you'll see happening is the administration focusing more on, you know, the nutritional values of the meals that we provide kids. Through the lunch programs. More and more kids, particularly in this economy, are getting breakfast and lunch at school. How do we make sure that we are giving children better choices? Because more and more kids are going to be relying on these meals as their primary source of nutrition.
Are we approaching a crisis level when it comes to the good health in this country and childhood obesity?
You know, I'm hesitant to use the word crisis just because, you know, you don't want anyone to panic about it. But I think that we have enough information to support the notion that this is a problem. 1 in every 2 African American and Latino children in this country are obese to the point where it will lead to diabetes and chronic illnesses that we will be paying for as a nation. And I don't think we have to call it a crisis to make change. It is what it is. You can look in your own neighborhoods, in your own families, in your own lives and see the truth of that. So we don't need someone to label it to know that we can fix it, we can change it.